Types of bleeding during pregnancy. It may be a horrifying experience to endure during pregnancy because it may pose a serious risk to the mother and child. There is a huge variety of causes that may cause bleeding during pregnancy, and all of them may not pose a serious risk to the mother or baby. It's imperative to consult the doctor in any case of bleeding during pregnancy of any amount. Vaginal bleeding is rather common during the initial 12 weeks, first trimester, of pregnancy. While vaginal bleeding during this period does not necessarily mean a miscarriage, but any sort of bleeding should be reported to the doctor, as maximum miscarriages occur in the first trimester of pregnancy. About 50% pregnant women experiencing vaginal bleeding in this phase will not have a miscarriage. If anything resembling fetal tissue is passed, it should be ensured that a doctor is consulted immediately. Miscarriage may be considered a natural process which deals with abnormalities, even though a miscarriage is not avoidable. It has never been proved if exercise and sex can cause miscarriage. As a matter of fact, regular exercise ensures that when a woman finally goes into labor, the woman is at ease if the exercise is carried out continuously during the pregnancy. It should always be checked with your doctor before one takes on any exercise program. Ectopic pregnancy is another major cause of bleeding. This happens when the fertilized egg gets implanted in one of the fallopian tubes. This is referred to as a tubal pregnancy. Ectopic pregnancy takes place in about 1 in 60 pregnancies and is therefore much less common than a miscarriage. Molar pregnancy is another extremely rare cause leading to vaginal bleeding during early pregnancy. This occurs when abnormal tissue instead of the embryo grows. While this may be referred to as a mole, but is commonly known as gestational trophoblastic disease or GTD. Cervical growth or an inflamed cervix often results in vaginal bleeding during late pregnancy. This is a serious risk to the mother or the baby and should follow immediate hospitalization. A problem with the placenta is often the cause of heavy vaginal bleeding during later phase of pregnancy. Placenta previa and placental abruption are two most common problems indicated by this. If the placenta is lying low, it may cover all or some of the cervix, and this affects approximately 1 in 200 pregnancies. A lot of women experience placenta previa during early pregnancy. It moves before labor occurs in most cases. A cesarean section is scheduled if a woman still has placenta previa even in the last weeks of pregnancy. If before labor occurs, placenta previa is present and not diagnosed, then there is a serious risk for both the mother and the baby, putting both at a risk of death in this situation. During late pregnancy, vaginal bleeding during the initial sign of placenta previa. The detachment of the placenta from the wall of the uterus during labor or even before is referred to as placental abruption. Mostly placental abruption happens during the pregnancy's last trimester. Whether vaginal bleeding occurs or not, mostly women will at least experience pain in the stomach. This complication occurs in 1% of pregnancies.